Sinus arrest versus sinus block, understanding sinus node dysfunctions. In our previous lesson, we concluded atrial fibrillation, a common irregular heart rhythm. In this lesson, we shift our focus to a different aspect of cardiac arrhythmias, sinus node dysfunctions. We will consider the distinctions between sinus arrest and sinus block, two abnormalities affecting the heart's natural pacemaker, the sinoatrial node. Figure 1 illustrates an ECG waveform of sinus arrest. This condition is characterized by a pause in the heart's natural electrical activity, resulting in the absence of P waves, QRS complexes, and T waves during the pause. In contrast, sinus block is revealed in Figure 2. It exhibits a delayed or blocked impulse from the sinus node to the atria, leading to intermittent pauses between normal heartbeats. Distinguishing between sinus arrest and sinus block is essential in the diagnosis and management of these sinus node dysfunctions. The key for distinguishing between sinus arrest and sinus block is utilizing the P wave. Sinus block presents with a P wave, however sinus arrest doesn't because the impulse generates from another automaticity focus. This is because in sinus arrest, the sinoatrial node fails to generate an impulse. However, in sinus block, the impulse is rather delayed, rather than entirely absent. In both conditions, this will lead to a decreased heart rate, bradycardia, and symptoms such as syncope, pre-syncope, chest discomfort, chest pain, and else related. The treatment for sinus arrest and sinus block may vary based on the severity of symptoms and the patient's clinical condition. It is important to accurately diagnose and evaluate the appropriate intervention. Recognizing the signs and symptoms of these conditions is vital. As aforementioned, sinus arrest and sinus block can manifest as dizziness, syncope, palpitations, and other cardiac-related symptoms. Risk factors for sinus node dysfunctions include advanced age, heart diseases, and certain medications. Identifying these risk factors aids in early detection and management. To summarize, sinus arrest and sinus block are distinct sinus node dysfunctions, each requiring careful evaluation and, if necessary, medical intervention. Understanding these conditions is pivotal in providing appropriate care. Thank you for participating in this SCPF Medical Department educational video.